presentation, so no need to necessarily take notes. We'll make that recording available after the presentation is over. So go ahead and enjoy yourself, watch the recording, really take it all in, and we will share that recording with you afterwards. So some things that we're going to cover today in this presentation and panel. First is the legal ramifications and how that relates to our current situation with COVID-19. Ramped up inclusion needs, retooling team roles, meeting and working online, and promoting and educating virtually. So I am noticing that we're having a little bit of technical difficulties with the captioning. So before we move any further, I'm just going to address that, and then we will jump back in.
We are currently experiencing some difficulty with our captioning. Please stand by while Andy gets that rectified with caption access. We want to make sure that everyone has access to this information. So please stand by while we get the captioning back online. Thank you. We'll start in just a moment. Hi, everyone. My name is Lynn Wehrman. I'm the founder and president, and Andy was supposed to do a really nice introduction of me, but he's apparently working on remedying an issue with captioning right now. I was wondering if in the time that we're waiting for the captioning to get online, if you would like to use the chat feature to send over any questions that you are burning that you would like to have addressed today, that would be great. The other alternative that we have, if the captioning is not working, we will begin in just a few minutes whether or not we have captioning, because we know your time is important. This is being recorded and we will have a transcript done and have the captioning inserted into the video. So we do apologize that there is an issue with the captioning. It is one of the perils of a live event. So if there are any questions that anyone would like to have addressed, please put those in the chat feature. You can also send them via email to our lead client relations specialist, Debbie Heilig, and I'm just going to put her email address in the chat box for everyone. If you would prefer to email questions over to her rather than use the chat box, it is Debbie, DEBBIE, at WeCo, THEWECO.com. Andy, we're about 7 minutes in, so I think we're going to need to get started without captioning. I apologize to everyone that the captioning is not available. Andy will be working on that. Andy, will it be possible for you to advance the slides while I present?
Yes, I can do that. I am also going to share a stream text link that Kelly was kind enough to share with me that folks can go to that link and then follow along with the captions there. So that is another option. So go ahead, check the chat box if you have any questions or need that sent. Again, send those questions to the email. Thank you.
Great, excellent, thank you. Well, I'll let you introduce me if you would like, if you're ready.
Our moderator for today's presentation is Lynn Wehrman. She is the founder and president of WeCo Accessibility Services. She is extremely knowledgeable in this space, having done the GAAD celebration and presentation for multiple years now. So we have a lot of great things in store. And Lynn, I'll leave it to you.
Okay, thank you. One of the things we're really proud of here at WeCo is that we are a group of digital technologists who actually live with the disabilities that we test for, that we train for. So when you're working with us, you don't get disability simulations, you get actual disability information. And last year, we actually were included as a national organization on disability, leading disability employer for 2019. And we just heard yesterday that we received that award again for 2020. So we're very excited to bring this information to you as a group of digital technologists who live with disabilities. And we hope that we're able to give you some experiential knowledge. Next slide. Just going to do a little bit of an overview of what the panel is going to address today. COVID-19 in an increasingly disabled world is a really interesting prospect for those of us who care about digital accessibility. Right now, 15% of people around the world live with a disability, and in the United States, more than 21% of us live with a disability. What's driving and increasing those numbers globally is an aging population and health factors that are new and different to us, that are oftentimes in COVID referred to as underlying health conditions that are prevalent in even younger populations. So those are the things that we know that are increasing disability rates around the world. And when we think about the fact that COVID-19 is a global pandemic, and that what we're starting to see from that pandemic is residual effects of COVID-19 from people who have recovered, we know that that will likely impact the rate of disability as well. So I think it's a really good thing to think about as we go into this topic, that for those of you who have been in the space of digital accessibility and have been working on it, you know it is something that is an inevitable part of business. But for those of you who are new to it, it's important to frame it in your mind as that this is not something that is a temporary condition. This digital accessibility is a necessary part of how we do business, how we educate people, how we employ people going forward. Next. So today we focused on 5 different aspects of COVID and accessibility and where we're at right now in this point of time. And first of all, we're going to talk a little bit about legal ramifications. We all know that there are legal aspects onto why we need to be digitally accessible. But does accessibility take a vacation when we're involved in a global pandemic? The legal requirements for accessibility simply don't go away because we're in a crisis, but how we respond to those legal requirements does shift and change. So we'll be talking about that within the panel today. And it's important to note that the pandemic has really emphasized inequality in ways that we couldn't anticipate. And I can see from the standpoint of a person who lives with a disability in a company where almost everyone in our company lives with a disability, those inequalities seem even more magnified to us. So that is something that we'll be talking about. Next slide. Also, we'll be discussing the ramped up inclusion needs. And what we've been seeing is a ramped up need or urgency to include, but in some areas there's been a stepped down response. We know that access to information and services to people who are deemed as vulnerable is exceptionally vital right now. We know that with everything moving online, remote learning, government websites, we're hearing that there is a lot more inaccessibility that's apparent. So we'll be talking about that today. Next slide. And retooling team roles. And I think this is really something that the members of our staff that we have on the panel are going to be able to help you with a lot today. Jobs we had thought that couldn't be done virtually before suddenly are being done virtually. And there are a large number of us who live with disabilities who've worked hard to break into different industries and the job market that are asking, you know, were we told that those jobs couldn't be done virtually before and now it's okay if they are because someone else is doing them? It's a great time for those of us that are employers to take a step back and think, are we hiring based on qualifications? Or are we hiring based on how we think work should be done? So today we're going to be challenging you a little bit to think more about the person and their qualifications and allow yourself to have a little bit more mental freedom about how your work is being done and how you can engage people who live with disabilities in employment. It's a real great opportunity to think about that. Next, then meeting and working online. So the virtual office creates a lot of opportunities to include. At WeCo, our entire company was founded virtually first, and we developed a couple of small satellite offices as an afterthought just to give a little bit more opportunity to work together. We had staff that really wanted to have an in-office experience. So for us, we've worked it kind of backwards. So we know that virtual offices are great opportunities to include, and that most of the roadblocks only require workarounds and a change of attitude. So we're going to challenge you today, not just through the people on the panel from WeCo, but people from other organizations that have done this, to consider making how instead of can't your default. Next. And then we're going to talk about promoting and educating virtually. The digital world makes it far, far more possible for you to include people, be they customers, students, coworkers, or talent you're trying to employ. So we'll be talking about that today. So without further ado, I would like to introduce our esteemed panelists. And we're going to start out with someone who is a colleague that I have been close to for a number of years, Bruce Howell, who is Accessibility Services Manager at the Carroll Center for the Blind. Bruce joined the staff at Carroll Center in July of 2012, and it was right about that time that he reached out to me to be able to engage some of WeCo's testers in some of the work that Carroll Center was doing. And I actually remember that that was right about a year after we had started WeCo. And for a while, Bruce used to talk to me, I think it was every couple of weeks. And he was kind of like my business psychiatrist. and he inspired me, and he gave me a lot of courage to do what I do. So he's always going to be very dear to me for that reason. He is a graduate of Colgate University and previously enjoyed a very long career in retail banking prior to coming to Carroll Center. In his current role, Bruce has primary responsibility for business development and project management. He works with clients to help them identify and articulate their digital accessibility challenges and assigns the Carroll Center resources to meet those needs for that client. Bruce serves as the primary contact with clients throughout evaluation and testing projects. He facilitates interaction between the Carroll Center team and the client. And he is a proficient user of some of the assistive technologies which the accessibility team service uses in conducting and evaluating websites and other digital content. So we welcome Bruce to the panel. And next we would like to introduce Heather Thomas. Heather is the Accessibility Services Associate with the Carroll Center for the Blind. She joined their Accessibility Service Department in 2019. Previously, she was an assistive technology instructor at the Carroll Center for more than 17 years, working directly with blind and visually impaired customer. Heather is proficient in the use of popular screen reading and screen magnification software for Windows and Mac, as well as iOS devices. She has also seen the impact of accessible and inaccessible digital content on users. In her current role, Heather works alongside Bruce to support various digital accessibility projects. She has a special interest in document accessibility and training sighted individuals to use screen reader software to test their content. So welcome, Heather. We're really excited to have this crew from Carroll Center. Next panelist is an individual who I also know very well because we shared an office space together. Rosemary Ugboja from Neka Creative is the CEO and founder of that firm, and her company worked alongside of mine in what I often refer to as our office. That was the adult study hall, in which we both had our teams working together in the same room. So there was a lot of learning from each other in those days. And Rosemary's Neka Creative is a brand development agency committed to bringing the power of inclusion to organizations through their proprietary process, Inclusivity marketing. And it's been wonderful to watch what they do and to work on projects with them. In addition to over 10 years of brand agency ownership, Rosemary gained her breadth of experience from various advertising agencies where she worked on a number of brands such as 3M, Frango, which is a wonderful chocolate we have in the Twin Cities, Excel Energy, Cargill and Johnson, Johnson & Johnson Vision Care. She also gained corporate experience as a marketer for Target Corp, where she handled marketing planning for essential products, new stores, and the first Target Pharmacy campaign. Most recently, Rosemary has led several strategic and creative projects, building inclusive brands for clients such as Merwin LTC Pharmacy, Penumbra Theater, Swanson Flow, The Commons, and branding the workforce system for the state of Minnesota. A testament to her zeal for excellence, her agency has won multiple awards and continues to be recognized as a leading voice on industry inclusion in the industry. Rosemary studied art and design at West Kensington College of Arts in London, and she has a Bachelor of Arts in advertising from the University of Minnesota. Rosemary currently serves on the board of Art Buddies and is a co-founder of Art West and serves on multiple committees that strive for equitable outcomes. Welcome, Rosemary. Next on the panel is Kelly Ryan, Director of Operations for WeCo Accessibility Services. And Kelly's career includes a long history of customer service, corporate training, and operational development, including building a call center from the ground up for a well-known national corporation. Raised by a strong working mother who lives with MS and living with her own disability, Kelly has an undaunted advocate vision for the inclusion of professionals living with disabilities in the workplace. This desire for inclusion brought her to WeCo last year to take over the development of our operations team as its director. In this past year, I can attest to the fact that Kelly has skillfully managed a very steep learning curve in disability employment and reasonable accommodation, and is helping to expand WeCo's person talent first inclusion model in our staff and tester teams. She works from her home office in Blaine, Minnesota, where she and her husband, Jim, are raising their daughter, Haley, and their son, Henry. Welcome, Kelly. And the final panelist, Linda Little, our Certified Test Consultant Coordinator here at WeCo Accessibility Services. Linda came to WeCo as our lead operations specialist in 2017. And like many of our staff members, has a very eclectic background when you consider what we do. Her professional background was originally based in landlord-tenant law through legal work that she did in the city of Chicago. Her heart has always been drawn to leveling the playing field for professionals with disabilities. Growing up with a brother with cerebral palsy and living with her own disability diagnosis, Linda possessed the unique background and understanding which enabled her to move to the newly created position of Certified Test Consultant Coordinator at WeCo just last year. As CTC Coordinator, as we abbreviate it to, Linda helps WeCo locate talented professionals who live with disabilities for technical roles in the company's certified tester and accessibility specialist teams. She also serves as WeCo's testers' professional support during their testing career with the company. Linda works from her home office in Modesto, California, where she lives with her husband, Ty. So welcome to all of the panelists. Thank you everyone for being here. Happy Global Accessibility Awareness Day. We are going to launch right into the discussion. And I want everybody to know that I have my large-faced alarm clock on my desk because we are going to try to limit our discussion on each of the 5 points to about 10 minutes. That way we'll make sure that we cover everything, and we will also leave some time for questions from the audience. So with that, we are going to launch into our first topic, which is to discuss the legal ramifications. So despite the urgency of all of our businesses moving online so quickly due to this global pandemic, the legal requirements of digital accessibility won't be going away. And I remember the day we had our last staff meeting in the office in early March, when one of our accessibility specialists looked at me and said, does this mean that our business isn't going to exist anymore because of the pandemic? And the first thing I said was, it takes a lot to repeal those laws. I don't think that's going to happen. So we know that that's where we are. Yet how people respond to the legal ramifications is no doubt changing. So let's talk about the changes that we're witnessing among those of you on the panel and how we market, educate, employ people as the world does this involuntary hard shift to virtual offices, classrooms, and marketplaces. So is there really room for digital accessibility in all of this chaos? I'd like to start out by asking a question of Bruce from Carroll Center. Bruce, from your standpoint, from the standpoint of an organization that assists companies with digital accessibility, are you noticing any changes in how people are responding to website and online inclusion since the pandemic?
Hi, Lynn. Can you hear me okay?
We can.
Awesome. First of all, let me thank you for inviting Heather and me to be a part of your program today for Global Accessibility Awareness Day. Carroll Center has been a longtime fan of WeCo, and as you described earlier, I've really enjoyed all the time that you and I have built our programs together and learned from each other. To answer your question, yes, we have definitely seen some changes as a result of what's been going on over the last 2 months in particular. We've seen especially institutions of higher education, both colleges and universities, as well as the companies that supply content to them to support their learning management systems. These would be companies that are in the business of providing digital textbooks and supports like that. Part of that, I think, has been driven by the fact that so many students suddenly had to be online and finishing their spring semester in a virtual environment. Some colleges and universities were better prepared for that than others. I'd like to tell you that it's always altruistic because the universities and colleges understand what they need to do and when they need to get some professional consulting assistance, but sometimes it's also driven by the Department of Education's Office on Civil Rights. And if they get a complaint from a student because they can't access things, they are very quick to go after these colleges and universities and try to get things resolved. So we work with them under those circumstances as well. A couple of the other areas that we're particularly noticing are, as everybody knows, all these states had to suddenly take phenomenal volumes of applications for unemployment, and there have been disastrous results in many states. I've heard that as many as 26 out of our 50 states had severe problems and breakdowns with those websites, a lot of which had to do with the accessibility of them, along with some other issues. So that's been certainly a big issue. And the third area that I would just quickly point out is that many of the e-commerce sites for grocery shopping, for instance, have suddenly seen incredible volumes. I've seen figures of like 3,500% increase in the volume of site visitors that they've had. So they've experienced challenges, and suddenly for people with disabilities, it's become a really vital way of obtaining critical food that they need, and it's been really difficult to go out in person and do that for a variety of reasons. So they're depending on these sites. So anytime there's accessibility concerns there, that's really putting people at a huge disadvantage at one end of the spectrum, and really in an almost life-threatening position in another.
Absolutely. Well, thank you for sharing that. Next, I'd like to turn to Rosemary. Rosemary is a marketing firm that focuses on inclusivity. Has the pandemic changed any of the requirements that you're seeing, for instance, in RFPs? Are clients asking for more help, less help, regarding ways or requirements to include vulnerable or disenfranchised groups on a higher level? What are you seeing?
Yeah. So again, thank you, Lynn and the WeCo team for including Neka Creative on this. I'll say we haven't seen much of a change yet. I think that people are just getting out over the shock. We're in the brand and marketing business. So I think what we did notice was people halting, slowing down, and we feel our clients are in a position to recalibrate. With that said, we do have government clients. So yes, we've seen with our government clients, even though accessibility is a core requirement for their deliverables, we're seeing that the RFPs for that are now trying to shift towards what can we do more digitally? We need some strategic direction about, doing more online. So we're seeing that there. In our other types of businesses, I think there's still a little bit of shock and trying to figure out what to do. As an agency anchored on advancing inclusion, though, we typically don't wait for our clients to request to become inclusive. We see it as our job to move them towards inclusion. So they could come to us with a problem to solve, and they may not have thought about the inclusion. It's up to us to infuse that in and bring them along. So we like to say is we're building inclusion in one brand at a time, whether they like it or not. So that's our angle to it as well.
And I think that's one of the fascinating things that's been about being in close contact with your business is seeing that and the synergy that's been between our two businesses because of that.
Exactly.
So thank you. I'm going to shift to Kelly, our operations director now. And Kelly, as somebody who handles recruitment and HR, what trends are you seeing regarding requirements for inclusion and disability employment since the pandemic?
Sure. I think that what I've seen the most is a push, a request, a call to action for companies to really start enforcing requirements of inclusion. Because what's being found is that the companies that already had that as a core value, already had that as part of what they do normally, have had a much more successful shift to this virtual world than companies who may have had a more rigid requirement. You know, there's a lot of people that work from home, whether they have disabilities or not, that are kind of starting to feel vindicated. You know, this working from home isn't a scary accommodation that's too hard to control or manage, because now everyone is doing it. And we just want to make sure that all of these businesses understand that this is a core value to have in their culture. And getting recruiters and hiring managers on board to start delving into a different candidate pool is going to really help them with the success of their business.
Great. That's an inspiring insight. Thank you. So we're going to move on to the next topic here, ramped up inclusion needs. We all acknowledge that the global pandemic is making digital inclusion even more vital to the needs and, in some cases, the safety of people we're trying to reach and serve. So why don't we take a look at how this is manifesting itself in real time for individuals and businesses. And for this, I'd like to move to Heather from Carroll Center. Heather, what are some examples of how the pandemic has made digital inclusion even more vital to the needs of the individuals you work with who are blind and visually impaired?
Sure, thank you, Lynn. So as we all know, everyday life and activities have certainly changed as a result of the pandemic. So for example, I know Bruce briefly mentioned a little about grocery store apps and websites, but many people may have preferred to go to the store physically in the past and have a little more control over the quality of the items that are being purchased. But with reduced transportation options and fewer drivers and fear of exposure, many individuals, more than in the past, may begin using these grocery delivery services and food delivery services. So it means that these websites and mobile apps need to be accessible and need to be tested. And the impact of that, combined with so many people using these apps and empty shelves, results in a long wait time for delivery and incomplete deliveries when they do arrive. And changes to apps or websites certainly can cause accessibility issues, especially when they're kind of made in a hurry. If businesses or organizations and government agencies need to add content to their website or post PDF files with information about the coronavirus or about changing operating procedures or reopening phases and plans, it's really important that that posted content be checked for accessibility so that everyone can access it. If transportation apps need to add a note about make sure you wash your hands and sit in the back, it's really important that just adding that one piece does not break the accessibility and literally leave people stranded.
That is so important. We've had our own stories on our own staff team. We actually released a blog in the early days of the pandemic about one of our senior staff members who is blind and in a wheelchair, and her husband is also physically disabled. And for years, they had depended upon grocery delivery service. And when the pandemic hit, they were forced to go shopping, which is, it's very difficult when you're in a wheelchair and blind and your husband does not have arms to go shopping in a store. And when the staff team found out that Maureen and Paul were shopping in a store, we put our volunteer network together, and then their church also stepped in to help. But that's a reality, is that many people who live with disabilities who are also depending upon delivery services now can't get them, because people who are trying to avoid going out, who were once going into the store, are taking all those delivery slots. So, you know, from our standpoint, we would add too that, is there some way that stores can create some sort of prioritization within their systems for people who live with disabilities, who need absolutely desperately, you know, physically find it hard to go into the store and are at much higher risk should they become ill. But so Bruce, what do workplaces often overlook regarding inclusion for people living with disabilities, or people that you work with who are blind and visually impaired?
I find that one of the most critical things for people working remotely now who are visually impaired is their ability to access the document files that they need to be able to do their jobs. In particular, in the work world, often you're using Microsoft Word, Excel, and PowerPoint files. And if those files, those documents aren't created in a way that builds accessibility into them so that a person using a screen reader can use those effectively, they will really struggle with that. Just in case any of the audience doesn't know what a screen reader is, for someone who's blind or visually impaired, we use assistive technology that actually we use our keyboard only because we can't see things to use a mouse click or to tap on things on a touch screen. So we rely on screen reader technology, which actually gives us feedback for what we're typing, where we are in all the various computer applications that we might be using. So there are certain structural things that you need to build in. It's called semantics into documents, for instance, a Word document that enables somebody to be able to, in effect, scan that document, get to where the sections that they need to read quickly as a sighted person would be able to do. You can look at a document when you can see, and you see that headings are oftentimes marked up with a larger, bolder type of font, so it draws your attention to it, and you know, okay, I'm just going to scan down through those headings and figure out what I need to get out of this document. Well, a screen reader can't do that unless there's certain elements that are built into that document when it's created. And people learn how to use built-in Microsoft Office accessibility checker to make sure that those features are being used correctly. So that's one of the most significant things. And the other piece of this related to that is, since we're all in this virtual Zoom world these days, and oftentimes we're doing screen shares where we're presenting a PowerPoint presentation, as Lynn did earlier today, it's really important for people who are visually impaired to have access to the actual files, PowerPoint slides ahead of time, because platforms like Zoom are graphically depicting something. They're visually putting it on there, but I have no ability to actually control it, to let my screen reader read that content, so I have to rely on the presenter. And it's much better if I have that in advance, so I can go through it, let my screen reader read it to me. I understand how it's structured, what graphics might be depicted there that maybe you know, the presenter isn't going to point out because he or she or they assume that anybody attending the meeting would be able to just see it. So those are my two major concerns that I would express today, the accessibility of the document files themselves, and then providing those to people in advance so that they have a chance to review it, understand it, and participate more fully.
Okay, thank you. And we had a little exercise in that, because I am actually an accessible document specialist, and that's what I cut my teeth on. And I know how to structure an accessible PowerPoint. And we were sending the PowerPoint out to the presenters early this morning. And what we're used to is that when you have a document structured accessibly, converted into PDF, that all of the accessibility characteristics will carry with it. So I sent it over to Bruce and said, okay, I don't know if you can get into this PDF or not. And it turned out that the native document was a much better thing for him to get into. So we just granted access through our file sharing system for that. But that was learning for me too, even though I've done a lot of this, that sometimes there's little, just ask. That's what we always say at WeCo, just ask, because people will tell you. So
You handled it perfectly. It was perfect, Lynn. Thank you.
That's right. It's not rocket science. Ask the person. So, but with that, because we're kind of moving towards a little bit about the employment part, ramped up inclusion, I'd like to ask Linda, our CTC coordinator, as somebody who works exclusively with candidates who live with disabilities, what tools and platforms do you feel work best when you're reaching out in including candidates? And everybody understand that Linda actually works with candidates who are blind, low vision, candidates who live with fine motor skill impairment, speech impediment, a wide variety of cognitive disabilities, hearing disabilities. So she really does have a lot of experience in this. Linda?
Okay, yeah, thanks, Lynn. At WeCo, we strive to make everything we do accessible and inclusive. Ways we do that are by having fully accessible position descriptions for every position we post. We also use accessible WUFU forms for applications for both our regular staff employees and our testing applications. We also use the accessibility of a Zoom room because it is accessible to people with screen readers and such, and we can close caption on it. And, you know, we've been posting to specific disability advocacy groups on LinkedIn, and that's created us to be able to connect with a lot more people that we hadn't been connecting with. So that gave us a really good candidate pool there. But honestly, I think the best tools out there are using the accessibility features and learning in Word and PowerPoint and all in Office 365 in general, and making sure all the tools you use are accessible, such as Zoom or anything like that. And we also do have different forms of interview processes as well at WeCo. We do nonverbal. I've also done chat-based interview, which was very fun. And then we do the regular standard over the phone via Zoom interviews.
So Linda, I think that you're saying that you really tailor that outreach and interview experience to the individual.
Yes.
Can you see a lot of variation sometimes within individuals who live the same type of disability regarding how they prefer to be interviewed?
Oh yes, I've definitely had like a couple of people with disabilities I didn't expect to need a certain accommodation happen, and it varies by person. It's very case-based.
Okay, great, thanks. Rosemary, we're going to shift back to you just when you've relaxed and muted your mic. Are the projects and client requests changing to be more, well, I think we probably covered this, more or less inclusive in the face of the pandemic? And is your company addressing digital inclusion more as a result? I think you already told us that you've had a lot put on hold, but this is maybe more towards your government clients?
Yeah, I would say, well, our company, we committed to inclusion, I think over 8 years ago now. And Lynn, you were right beside us. We were in that space. Now, just a little bit of our history. We did start out as a brand firm. We do extraordinary branding. But a couple years into that, it really came to, what do we really stand for, right? What's our purpose? Why do we want to get up every day? And at that time, we had been working on projects that had to do with, marginalized communities, people who just don't have a say. And we're doing those for really free. Those are our pro bono work. So we decided to say, you know what, let's make this about what we do. But the moment we decided that we were going to stand for inclusion, immediately we figured out how. What does that even mean? It sounded really good, but how do you operationalize being an inclusive company? I would say working beside Lynn and her team was really, really helpful And Lynn says, just ask. I think that's what we did the whole time, was we asked. So I think once we made the commitment to be inclusive, we've had to stretch to actually be inclusive. And we stretch each and every day. One of the early things we did was we're very flexible. You cannot be inclusive without flexibility worked into your company culture, right? You cannot be rigid. We've been a semi-virtual operation anyway, and to be semi-virtual meant that the tools we use for project management or any tools we use have to be accessible. So that takes us longer to find those tools. It might even cost you a little more, or it might hinder you from getting their latest update because sadly, a lot of software developers, they might have started out being accessible, but one update can mess the whole thing up. So these are things that we've learned as we strive to maintain our stance on being inclusive. Now, when this pandemic hit, right, it stretched us again. So yes, for our team members, we strive to be inclusive, and we're fortunate to have team members that we can just ask, does this work? Does it not work? Right on the fly. But the work we do with our clients, a lot of that work has to do with workshops. We're brand builders. So we go out there and we have these fun interactive workshops to get insights to help them build their brands. But now that we can't meet in person, our active projects, now we had to move our workshops digitally. And immediately I knew we had an issue. So we spent the first 2 weeks of stay home trying to figure this out. One of my first calls, on my first call, was to Lynn and said, okay, we're going to be doing a whole lot more digitally here, especially for video conferencing. We need help. We immediately switched from what we were using to Zoom because we just figured out, okay, this one seems to be more accessible. But then we got to the next level. How do we make sure that it is truly accessible in how we use it? And Lynn and the team were able to put together a white paper for us on the do's, the don'ts, and tips. But then now our workshops, how do we have workshops digitally, right, that are accessible, that are inclusive? So that made us really look for tools that were easy to use. We broke down workshops that we would normally do in a 4-hour, half a day. You're locked in a room and we get all the information. But we had to divvy that up into sections over days. Now, using the workshop tool and the functionality of Zoom, we're able to have breakout rooms. So ahead of time, we know who does not have access to the workshop tools. And we can work with them one-on-one in a breakout room or as a group so that we still get their input and they're still able to participate. So yeah, this has made us even extend even more into saying, okay, now how do we facilitate virtual workshops when we can't be there in person? So that's how we as an organization have evolved. And we welcome that challenge of being able to stretch. Like I said, for our clients, we tend to be the ones to lead. We rarely have a client come to us and the first thing they say is, I want our company to be inclusive. No, they want to make more money, right? They want to reduce, the number of, they want to attract more people to work there and they want to retain more people. It's up to us as an organization to bring that lens to them and say, well, by becoming an inclusive organization, you can accomplish these things and more. So that's sort of the role that we play in the marketplace. Our government clients, yes, right from the get-go, how are you going to meet these standards? But a lot of our other clients aren't there yet. I mean, there is a statistic, I think 72% of organizations strive to be inclusive. They want to be, they say that they're working towards it, but only 12% of them actually accomplish inclusion. So we have a long way to go. And that's why we know we keep on, it's harder to do this. It's much easier not to be inclusive. It's easier to just get up and do things the way you've always done them. But I would say you're really going to miss out on great talent, a great customer base, and just a better world if you don't take the steps and stretch to do that.
Right. And it has been, you know, that's why I think Neka is such a great example, because they live it internally. And I'm gonna actually get back to Rosemary and talk a little bit about me witnessing them go through that process of retooling team roles. But then they also have been able to help other people see that they need to do it too. So that's pretty fascinating. So the next section we're going to talk about is retooling team roles. COVID-19 has forced many businesses and learning institutions to rethink how they do their work. So let's talk about the potential opportunities for inclusion here while we address the challenges. And so with that, I'd like to shift over to Kelly, our operations director. And Kelly, based on your career management experience, not just at WeCo, but you've had a lot of experience managing other people, you know, outside of a company that focused on disability employment. How does onboarding a candidate who is differ from candidates who aren't? And how does this difference carry over into virtual office?
Sure. You know, onboarding and training any new hire really does follow the same rules. There's documents that need to be filled out. There's training that needs to be done. The only difference that I have found from my past job to this job is how we approach accommodations. So we start talking about accommodations really early on. We talk about it in our request for an interview. You know, we're going to interview you through Zoom. Will you need an additional accommodation to be able to participate in this interview? We send out a welcome packet on their first day of work. And in that talks about our accommodation process, how you can request, where you can request it, and what that process will look like. And then in our orientation training, we do that all virtually through Zoom. You know, we've already talked about whether they need closed captioning or not. We follow the same rules of PowerPoints that have already been talked about. And that's different from before when I worked at other places, because accommodations really never got brought up. This is how we do our onboarding, and this is how you're going to do your onboarding. And to follow the theme that's going on is you just need to ask, you know, how do you access technology? And is the way that we're doing this, are you able to access it the way we're doing it? If not, what do you need? And what we find most is that our staff will already have the tools that they need. You know, if staff use screen readers or braille displays, you know, dictation, like tools like Dragon Naturally Speaking, they will already have them and will usually provide them for themselves. And if what they need is above and beyond that, you're able to have that conversation with them because you've already laid that groundwork of pushing accommodation, because it's not scary at WeCo. We don't shy away from the word accommodation at all. It's a part of our everyday life. You know, some of the things that we do for accommodating is we really try to offer multiple ways of getting our information to people. So if someone needs to fill out paperwork, like an I-9, you know, find that electronic form that they can just fill out on their own instead of having to print it if necessary. We have different training approaches available for people that can't simply learn by just watching a video, which is again why we like to do virtual live orientations for new hires, not just because it's accessible, but it really does start to help build that culture of, you know, the employee and company relationship as well. So to tie it all together, the biggest difference is asking.
Well, and may I be so bold as to say that it's normalizing.
Yes.
And I remember Kelly coming to me and you know, when she was first really revamping how we're onboarding, and she said, we just need to make accommodation be a normal part of every day.
Yes,
And
it was never talked about at my old job. And this job was a multi-million-dollar organization. And I heard the first word accommodation at WeCo. So, you know, pushing that out and really saying, hi, it's not scary to talk about, tell us what you need, you know, that it draws that inclusion in so much more than having 100 employees and not knowing if any one of them is living with a disability or not. So yes, normalize, 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 and ask.
okay, great. Well, I have to get to the story because I think it's such a great story of retooling. When Rosemary's company and ours were working side by side, and we were both little tiny startups and growing, Rosemary and I used to talk a lot, and she said to me, I really need a project manager. And at that time, we had an outstanding, one of our lead certified test consultants who was looking for clerical work, and she was an excellent admin. And she had interned with us. We didn't have a capacity to hire her at that time. We knew she needed work. And I came to Rosemary and said, I really think you should hire Nina. Just give her a try because she is phenomenal at organization, great at, you know, keeping track of massive amounts of detail. And when I mentioned that she was blind, Rosemary said, well, it's just not going to work because our tools just don't work for people who are blind. And I really pushed her and challenged her, and I give her a lot of credit because she just, you know, said, okay, I'm going to interview her and I'm going to see how this goes. And it was within a couple of months, she came back to me and said, this wasn't nearly as hard as I thought it was going to be. And, you know, when we finally got to the point where we were able to afford to hire Nina, we can't rent her back from Rosemary. So, and it's, you know, and I think it's such a great example of how it's really easy to get into that mindset of thinking that because someone lives with a disability, they can't, or they can't do it in a certain way. And I think that Rosemary did such a great, and her crew did such a great job of talking to Nina and finding out what Nina's devices were, what techniques she needed. Then they took a look at what they were using. And honestly, some of the things that they learned from that interaction, we adopted at WeCo, like a project management software we didn't know was accessible. We were doing a workaround with one that wasn't. So I just wanted to ask Rosemary if you had any other insights to share about that process, because that was pretty magical.
Yeah, and I think magical is the right term there. And just, I mean, that's the testament to working beside Lynn. And yes, Lynn did say, so we're a brand marketing firm. Think about it, we're advertising, right? It's a very visual industry. Clients typically will give you feedback. They'll scribble things on concepts and you take that feedback and you make changes. So it took that step back and going, okay, how can we make this work? And it was through discussion, right? We chatted with Nina and she explained about the sight readers. And then, you know, we tested some of our tools. We started using project management tools that, that would work. And I would say, I think Nina's listening to this, so she's probably blushing where she is. But Nina has been an absolute asset on our team. And I'll tell you one of the reasons why. What we lack, she has. An ability to remember absolutely every detail. We don't have that. I don't have that. We can ask her any question and she gives you the answer right away. So everyone on the team knows that she's a great asset to us. And we not only stretch ourselves in how we make sure that Nina has the tools to do her best work, we train our clients. So what we've had to do over the years where clients will scribble something, scan it and send it to you, we go back to them and say, no, you've got to use this PDF tool. We have a cheat sheet on how you mock up a PDF so it's accessible. That way, everyone in our company can see your comments. So we completely discourage written on notes, markup on concepts, because it's not accessible. And we just explain this to our clients and they get it. So just, figure out how to use a comment box, learn how to do this so that everyone on the team can help you. So the tools we use, we run them through first to see, are they accessible? And even if I have an itch for something new and great, if it's not accessible, we're not going to use it. It's not something that we would put on. And I think it also works in other ways. Society has really made us think that people living with disabilities don't have as much to offer. And very sadly, some people with disabilities too can believe that's true. So there is nothing as great as providing opportunity, right? And having people for a change be able to give to the society what's been buried in them for so long that people haven't given them a chance to deliver. And I would say for me, it's been, these have been aha moments as we've gone on this journey of being inclusive. Just to hear someone say, what are you thankful for? And their response would be that I can contribute to society. Now, how don't we make the world a better place that way? And it really didn't take that much. It doesn't take that much to retool so that we can serve everyone and have everyone serve to the best of their capacity to do so.
Thanks so much for sharing that. It is a really, really powerful story. I would just piggyback on that a little bit, that probably one of the most moving moments that I ever had was in the creation of WeCo, was in the early days when we were back at that Jewel collaborative office together. Someone who's become a valued employee and a dear friend, Chad Cook, our senior accounting specialist, I was simply holding the door open for him so he could go through in his wheelchair. And I said to him, hey, thanks for coming in today. I really appreciate it. And he looked up at me and he said, no, Lynn, thank you. Prior to coming to work here, all I did all day was sit in front of the television. And that it's one of those moments that I carry with me. And whenever keeping this mission moving forward seems hard, I think of that comment, because I'm not exactly sure how we got to this point in history where the talents and skills of people living with disabilities are devalued to this point, but it has to change. And if there's anything that we're living testament to everybody on this panel, is that it's a powerful thing when it does change. So just to make sure that we're moving along on topic here, I wanted to shift back to ask Rosemary one more question about taking an office that, you had an office presence and suddenly you had to move onto virtual. Do you think that was a blessing or a curse? How did that shake out for you?
Yeah, well, we've always been semi-virtual. So our operation was designed so that people could work, being inclusive, can work anytime they wanted to. We don't have work hours, right? That takes into, it accounts for just working around your life, right? We don't have that rigidity of work hours. But we had our office space because it was fun to work with everyone. It was fun to see people. We had a lot of celebrations together. Our clients would come and visit, but we were semi-virtual. We weren't necessarily in the office every day because we want to make sure we have that flexibility. So our office existed for people who wanted to come into the office, unless, except for moments when we planned a meeting at the office. And think about it. If you're living with a disability, you've got to rely on Metro, on the transit system, Metro Mobility. Right. That is one of the most unreliable systems we still have. And so imagine the stress and strain of trying to get to a job on time when it's out of your control. So why do we have hours? It really was not important to us. And then coming into the office, when we found our office space, accessibility and access was key. We found the best space we could at the time But again, we're going with Metro Mobility. Where do they drop you off that you can now walk in safely to the building is a whole different discussion than what the building amenities are, right? So we've always been semi-virtual for some of those reasons. So now that we have to stay home, we're just at home and having to meet more using the tools, the video conferencing tools and our project management software to communicate on projects. So yeah, so we were one of those organizations where it wasn't a hard shift to make because we've always been thinking through flexibility anyway.
Great. Well, and it was another way to grow. So to try to wrap up this section, I want to turn to Heather because I know that Heather has actually just released a book on making Zoom accessible to people with low vision and blindness. So Heather, you had said that there is a way that you could delegate responsibilities in a Zoom virtual meeting to make it more efficient for everybody. And I was wondering if you would share some of those tips.
Yes, thank you. So if Zoom or your other online meeting platform allows it, spreading duties around will really make a smoother meeting rather than having the speaker worry about speaking and also allowing people in from the waiting room and monitoring questions. If you can assign hosts or co-hosts, depending upon the type of account that you have, it will just let the speaker focus on speaking and getting their message out there and just let things run more smoothly. If everyone's muted in the beginning, that host or co-host could unmute people as they raise their hand and just not let all that fall on one person. In Zoom specifically, the JAWS screen reader announces messages when people are raising their hand and when they've joined or left the room. And those are great when you want to hear them, but if you're the speaker, they can be really distracting. So you may want to actually turn those alerts off, but then the flip side of that is that you're not necessarily going to know when someone's raising their hand. So having another person do that can really help out. And then just really letting that speaker focus on just doing one thing so that each person in the meeting has a role that they're focusing on.
That's great. And there are things that those of us that are visual users don't often think of. So those are great tips. So next we're going to talk about meeting and working online. So this brings both challenges and triumphs when we're talking about a virtual office that includes everyone. So I'd like to see what kind of wisdom we can glean from the panel on how they navigate working online, meeting online in their inclusive environments. And I think that it'd be great if we could start with Linda, because I'm really curious, Linda, what unique challenges do you face when you're working with a team of people that you never meet in person? And most of the people that Linda recruits and manages, the entire relationship is virtual. And if you want to throw in there about, well, we'll just start with that part first, and I might have some follow-ups for you.
Well, I guess the biggest challenge I face is trying to foster and create like an office type environment for my team that they could come to, you know, something more professional, you know, that, you know, they can come to me and I can help them with anything. But it's a struggle to do that. And I know we do a lot to foster that. We do bi-weekly newsletters to our testers that's got company updates in that, little tidbits. We do company happy hours. We do virtual company chats for our testers that they come in, and it's on different topics provided by the staff team. So we do our best to try to create and foster that environment, but it is a struggle.
So I'm going to shift to Kelly next. How do you help your employees manage an in-home office?
Well, I think, you know, communication is always key. I think it's a wrong idea to bring someone on, maybe someone that's never worked virtually before, and just say, best of luck, set up your home office, and really create that successful work environment. And I think it's really important to offer as much guidance and support as possible. You know, we have something called our guidebook that has an entire section on different ways that a home office could look, different options like having an office in a crate or having an office in a walk-in closet, you know, showing people different ways that they can make that work. And then constantly checking in with them. How is it going there? Are you finding enough time when it's quiet in your home? Do you need anything from us to help you make that a successful work environment? And then, you know, I kind of a little bit of what Rosemary already talked about, so I'll just spend a little bit of time on it, but we offer people to choose whether they want to use flex time, so have flexible schedule, or if a rigid schedule would work for them. You know, some people living with a cognitive disability might really need some rigidity in how they do things, while other people will need a more flexible situation. You know, they have PCAs coming in, doctor's appointments, children doing distance learning, and it really allows them to pick the schedule that works best for them. We have, I believe, 2 people that start work 5 o'clock in the morning, because that's when they're the most productive. That's when they feel the best, they're going. And then we have people that don't start until the afternoon, because that's when they feel it's best as well. So, you know, really offering support, a lot of communication, trying to provide as many options as possible, and then giving them the chance to just do their jobs. You know, I've interviewed you, I trust you, you know my expectations, I've given you the tools to get those jobs done, and now I'm going to let you do them. And I think that we have found that works really well. Rosemary talked about using some project management tools. The one we use allows us to set tasks, set deadlines, a back and forth communication. And so we're able to have really clear communication on what we need. We have accountability if deadlines aren't met. And so we've kind of taken this virtual office, you know, how do we manage it? How do we control? How do we know people are working? And we find ways around it. And I think, again, it's really important that you trust the people that you hire and make sure they know that it's a virtual office, and you trust that they can do it.
Yes, yeah, and I think that at WeCo, we've just always been results only environment type of thing, that if you're not doing your job, we'll find out. So we're just going to trust you to do your job.
You know, I think one more thing to talk about with a virtual office is, WeCo is extremely process-based. And we joke that we have a process for literally everything. And so it's important to look at your processes, and if they're not working, fix it. If you're finding gaps in your process, empower your employees to fill those gaps. They're the ones out in the field doing it. Make sure they have the process, and then make sure that they're using the process.
Yep, that's a lot of what we talk about. It's there. Are you reading it?
Kelly, this is Andy. We just had a quick question come in, see if you could touch on it. An attendee asked if you said something about office in a crate.
Yes.
And if so, could you just expand on that a little bit?
Sure. So, maybe someone doesn't have a room that can be an office or a large desk space, and perhaps they need to use a kitchen table. So one of the options is to maybe get a large crate that you put all of your work stuff into. You start work, you take it out of your crate, do your work, and when you're done, you can put it back in your crate, put it away. Not only then do you have your space back, but I am done with work. I'm not gonna come back in, when I'm bored and stress myself out working more. it's a nice option of utilizing smaller spaces and also a little bit of time management.
Okay, Peter, we will allow time for questions, I promise, but I want to get back to Bruce because I'm dying to ask him this question. Bruce, is it reasonable to expect that people who are blind and visually impaired can appear on video? How do you do it?
Yes, great question. It's really important. And let me just say something really quickly. Kelly, I'm so glad you explained The Office in a crate, because you don't know what I was picturing in my mind when you were saying that. So thanks for explaining that more thoroughly. Yes, a great question about whether someone who's visually impaired and blind should be expected to use video. And I think there are just three really important considerations about that. First is, if you're going to be using your video, you have to understand that you're presenting this to a sighted world. What that means to somebody who's blind is that they need to think about things like their own personal grooming. What are they wearing? Is their hair neat, clean? For women, if they use makeup, or is the makeup applied? You know, are you presenting yourself visually in the way that you would want people to be able to see you? So I think that's a really important consideration. And you may not be able to figure out exactly where your web camera is located and how it's focusing on your face. So you might have to ask somebody sighted who's participating in the first Zoom meeting that you hold, hey, are you seeing the right part of me? Are you seeing my entire face, or are you only seeing the top of my head? Once you get that feedback, you'll know what angle you need to have the your laptop screen set at, or if you're participating through your smartphone, how to hold your phone so that you're making sure that you're focused correctly on the face, what you want to show. Related to that is, what's the background behind you? I've really thought about today, and hopefully the way it's presenting for me is that I've got a fireplace behind me. So it's a pretty neutral setting. It's pleasant. It isn't showing things about my personal life that I don't want people to see. If we were doing this at night, if I'm blind, I may not normally have lights on in my house. So that might look really strange to people. So think about that. You've got to make sure your lighting is what people would expect if they're going to see you. But I think the most important thing, and part of this question that you're asking, Lynn, is whether someone who's blind, for instance, even wants to display their video. This could be a form of disclosure about your disability. Some people that are blind, it's very obvious when you look at them that they're blind. They may have eyes that are damaged. They may be wearing sunglasses in a situation where you wouldn't typically expect somebody to be wearing sunglasses. So when we talk about working with disabilities, it's always a big question is, when and how do I disclose that I have a disability? So you need to think about who you're talking with, what the fact that you're putting your video on yourself might reveal to others. And one of the things I can suggest is, because there really is some truth to video taking extra bandwidth when you're trying to participate in things through Zoom, if you're really uncomfortable about that and don't want to really explain it, you can always tell people, I'm leaving my video off because I get better audio reception through Zoom, and they should be okay with that.
Yeah, and I think that's an important point. I live with a cognitive disability. I have a mental illness diagnosis, and this winter, my mental illness was really active. I was in a severe depression, and I was in a client meeting that was virtual, and the project manager kept insisting that I go on camera, and I was in their virtual meeting room, and I'm not exactly sure how this worked, but they kept turning on my camera and I kept blocking it. And realizing that this can encompass people who live with all kinds of disabilities. At that point in time, for me to be on my game and be present in that meeting was taking all the energy I had. I did not want to be on camera. And it took a little, it was actually one of the oddest business situations I've ever been in, where they were over and over insisting that I should be on camera. And it was a little embarrassing, but I persisted and it wasn't on camera. It is something that I think is, that is an etiquette piece that I think is part of digital inclusion in the workplace and the business environment. That's important. We're going to want to get to questions, but I'm just going to wrap up this panel section by saying that I think we all agree that despite the unique pressures of the global pandemic, It's vital for all organizations to prioritize equal inclusion for people living with disabilities right now, particularly with health and safety, but also with education and employment. And some of the organizations that we've worked with at WeCo, Carroll Center has worked with, Neka has worked with, are well positioned and ready for this, but there are others that are really being daunted by it. And we just want to assure the audience that we are here, these three organizations are here to help in any way that we can. So we'd love to open up the rest of the time to questions from the audience, and we'll look to Andy and Debbie to moderate those, and I can help direct questions as needed.
Thank you, Lynn. So we have had quite a few questions come in through the chat. So we'll go ahead and start with the first one. So this first question came in: what are the common technological barriers that are being encountered due to changes in business operations from the COVID pandemic? Are there any new barriers that are experienced?
Bruce or Heather, would you like to speak to that? Oh, Bruce, you're muted.
You're still muted, Bruce.
Okay, I must be having, there you go.
Sure, sorry. Can you hear me now?
Yes.
I feel like the guy in the Verizon ad. Can you hear me now?
That's one of the barriers right there.
Yeah, you know, it's funny when I move around, like to get into the chat room, sometimes it's a little funky what happens when I try to get back to the main meeting tool of Zoom. So just a learning process, so I apologize. And I really am sorry, Andy, now I've flustered myself so much. What was the question that you had out there for us?
Not a problem. The question was, what are the common technological barriers that are being encountered due to changes in business operations from the COVID pandemic? And are there any new barriers that are being experienced?
Wow, I think we've touched on a lot of those today. So one of the ones that Heather really talked about that we probably should have talked about more is the whole issue of public transportation. Rosemary also mentioned that, by the way, but when, at least here in the Massachusetts area, obviously things have been really shut down, and that meant that all of our public transportation system went on a weekend schedule, which meant less frequent buses, trains, subways. In addition to that, of course, the rules were ever changing about where you had to enter the vehicles. You know, I, as a person who's blind, I've been trained through my orientation mobility instructor to line myself up at a subway station so that I'm getting on at the front of a car in case I need assistance from the conductor. Well, suddenly the rules all change, and although I technically could still do that because I was granted that exception, everybody else was entering the subway through the middle of the car. So it changed things dramatically in terms of transportation. I also use rideshare service all the time, and I knew that suddenly there were going to be fewer drivers and that they are undergoing the kinds of changes that Heather described. So just getting to work became a bigger challenge for us. But beyond that, one of the biggest things, and I don't think any of us talked about this today either, is the whole telemedicine process that everybody is lauding now as being great. This is wonderful. What a great solution. Well, not if the technology doesn't allow you to easily be able to interact with your physician, you know, your primary care physician or any other medical specialist that you might need to be interacting with. So if you're a person with a disability, maybe you have trouble navigating those sites. Maybe you want to be able to show your doctor that you got an injury to your leg, but you use a wheelchair and your tablet is strapped in place to that wheelchair, so you can't move it and you can't change it, the orientation from landscape to portrait, to be able to show the doctor what you want to do. So I think we're seeing just implications of this current situation that none of us dreamed of or had fully understood how important they were going to be. And these are the kind of things that I hope we work through and give a lot of attention to as we go forward.
And I'll just add to that, because this one was interesting, is that it came to our attention at our last staff meeting that there is something that happens to people with cognitive disabilities. We've got people on staff like me who live with anxiety disorders and mental illness, and other people who live with attention deficit disorder, that being frequent Zoom meetings can really up the ante for those of us with ADHD and anxiety disorders. And so after that meeting, and I think Linda's okay with me talking about that, her and I were both anxiety people, and the other employee, we were like, oh my gosh, that's what we've been feeling. So I think recognizing that if you've got staff that live with certain types of cognitive disabilities, that the frequent online meeting thing can be very hard on them, and that they may need some accommodation and some breaks around that. And particularly if you work in tech, you have people who live with cognitive disabilities on your team, high number of people who live with autism, live with anxiety disorders that work in tech. And you realize that even if you don't know about it, they are there, and that you're going to need to give people some space around that.
Lynn, if I can just add a little to that, I think frequent Zoom meetings are creating anxiety in those of us who have never had anxiety diagnoses. May I say for the record, I am exhausted at the end of some of my weeks through all the Zoom meetings I'm attending right now. So very real.
Should we take another question, try to get a few more in?
Yeah, the next question was, you might be able to answer quick, about PowerPoint and how PowerPoint can be made accessible for those using screen readers and other assistive technology.
Well, they absolutely can be. So my talk this morning was a little bit more, or my talk earlier was a little bit about something that I had quickly put together for Bruce. But both Carroll Center and WeCo teaches classes on how to structure accessible PowerPoints, and we also have services in which we can do it for you. And let me tell you that this is not rocket science. You can learn it. We require all of our staff to learn how to make Microsoft documents accessible when they get hired with us. We do not care what their role is. They have to learn how to make MS documents accessible. And try to handle another one.
Yeah, let's keep it going. So the next is just if someone were to encounter a website that has linked buttons which are not labeled, how might they help the company to resolve that issue so the website's interactive pieces can be read by technology?
Bruce, I think that is going to be you or Heather again.
I'll start, and then if Heather wants to add anything. So, you know, this question, I'm not exactly sure why they're asking the question. So if you're talking about how do you actually let the company know that there is an issue, what we recommend is reaching out. If you can find an accessibility page or statement there, typically there would be a email there, which would be the most appropriate person to reach out to. And if you do that, you want to make sure that you're explaining what device you're using, what web browser you were using, and what assistive technology, including the version you're using where you encountered the issue, and then try to describe it as thoroughly as you can. So that we try to teach all of our consumers to be good advocates for accessibility, but you can complain to a company and you're not going to get anywhere. But if you can try to be helpful and constructive in the information you're providing, you're more likely to get a better response. So that's one answer. If they're asking literally, what do I need to do to make a button, submit button announced properly, that's more technical. There's something called ARIA, which is Accessible Rich Internet Access, which is a coding thing that you can do to various form elements in order to change and improve the labels so screen readers will understand them and be able to use them more readily. Heather, I don't know if you want to add anything to that.
I suppose just that you'd want the visual label to match, or the spoken label to match the visual label, so that people using speech recognition software would know the name of the button to click.
Yeah, that's great. And talk about speech recognition software, because it was mentioned before. What's an example of that?
So one example would be Dragon Naturally Speaking.
And these are individuals that are actually speaking the command, and then their computer is reacting to that. So if somebody sees a button and it has a visual label that says one thing, but the label that's assigned to it through ARIA is different, they can say over and over the name that they're reading on their screen, but it's not going to work because it doesn't match that ARIA label that was given to the button.
Wonderful. Just real quick, Heather, could you let the audience know where they might be able to access the guide that you mentioned earlier in the presentation?
So it's the Getting Started with Zoom Meetings for JAWS and NVDA users, and it is available through the Carroll Center store. So if you go to www.carroll.org, Carroll is CARROLL.org, there is a shop button that can be activated to go into the store.
Wonderful, thank you.
You could also email either one of us.
Yes, that's true. That might be easier. I could send you the link.
And we can make that resource available in our recap email to everybody so everyone can get the link as well.
Wonderful.
So should we squeeze one more question in as a final?
I got one more in here. How are face mask requirements in public spaces affecting people with various disability and accessibility needs?
I think that's a really, really great question. I'm not sure who on the panel that we could direct that to. Does anybody want to take it?
I'll take it, Lynn.
Okay.
Well, I've noticed, and I can say from my personal experience with my brother, some people with disabilities can't wear a mask. They have issues with it where they just can't wear one, or it impedes their breathing too much, or it's just too uncomfortable for them to wear. So I've noticed a lot of people with disabilities aren't wearing masks because of that issue as well, but there is an equal amount of people wearing them as well. So, but I think it's just affecting different people with different disabilities differently.
I think that's why it's such a hard question to answer, is because it really is each person. I know I have really high anxiety a lot, and it's triggered a lot if I'm in a small space. Wearing a mask makes me feel really claustrophobic, and so I really try to limit the amount of time that I'm wearing it, which means that I usually send my husband out, because the lack of being able to breathe well and it being on my face can make me really, really anxious. So that's my personal experience.
And I just want to put a plug in there. It's really a statement on empathy. There's so much that we don't understand, and there's so much that we would never understand firsthand. But as a society, I feel if we approach things from a position of empathy, with the assumption that there's probably a really good reason why, and then fill in the blank, that we will get much further along. Right now, I think wearing a mask, people that wear a mask in some regions could be ridiculed for wearing a mask, and in other regions, ridiculed for not wearing a mask. So I just think it's collectively just being empathetic and trying to understand that there's no such thing as normal, right? Everyone has their own individual norm, and it's meeting people where they are. Yeah.
And I think giving people the benefit of the doubt is really, really important, especially right now.
Yeah.
So I think that is our event. We want to thank everybody on the panel. Thank you to Bruce and Heather from Carroll Center for the Blind, Rosemary with Neka Creative, and from our own WeCo staff, Kelly and Linda. I think that this has been just a lot of fun for me, and wonderful to just get the insights of these people I get to work with who are so smart and so forward thinking. So with that, Andy, we will let you wrap up the program.
Thank you very much, Lynn. I just want to wrap up and say thank you again to everyone in attendance, Thank you again to WeCo, the members of the teams at the Carroll Center for the Blind, as well as Rosemary from Neka Creative. As I mentioned before at the top of the meeting, the recording will be available at the end. We will send that out to everyone that was registered for the event. If you do not receive it or have any further questions, feel free to reach out to Debbie at theweco.com. That's DEBBIE at THEWECO.com. Thanks again, and hope you all have a great evening.
Thank you.
Thanks, everyone.